first. Just put the cheek retractor in the mouth. So just keeps it nice and safe, keeps your lips well away from the teeth. Open up nice and wide for me. Thank you. Right, okay. Can you just bite down on that for me, please? Okay. Is that comfortable enough for you? Yeah? I know it's not ideal, but it's not unpleasant. Great. Basically what we're looking to do first of all is just dry off all the teeth and the gums, and then once we've done that we'll have a look and see what shade we've got, which gives us something to compare against at the end. Well, the surface of the tooth has to be completely dry to allow the gel to sit there, and obviously to get to work effectively. If the gel if it's sitting on saliva that's sitting on the teeth, then the gel can possibly slip off the tooth, but it also has to work its way through the saliva before it starts getting to work on the teeth as well. So that's why that's important. Okay, you got a nice wee grip of that there just now. Right, so let me just pop this in here. Okay, just before you start, I'll just put a nice little balm on your lips to keep them nice and moist. Once we've done this, the next step is just to apply the gingival barrier, or otherwise known as the gum dam, just along the gum line basically, which just protects from any contact from the gel. So we just apply this along the gum line, which again is just a kind of safety. It just acts as a barrier. It's basically just prevents the gel from coming into contact with the gum, which if that were to happen, it can cause a wee bit of irritation. So it's a kind of belt and braces scenario. Obviously I'm extremely careful as to where I apply the gel, but this allows for any kind of error of judgment, or indeed particularly in the bottom of the teeth, if the gel was to move, as gravity takes, if the gel was to just kind of slip down the tooth slightly, then it would just rest upon the barrier there, as opposed to the soft tissue in the mouth. So that's applied in its gel form, and we'll just apply the curing light to that, which will just help it to set and solidify. Then almost becomes like kind of candle wax. So protective eyewear, again, kind of two reasons for this. I guess first one would be in the event that I was really reckless, or, with the gel, or if for some reason a wee bit of gel was just taking a squirt from the syringe. This way ensures there's no product ever going to get in their eyes, and it also protects you. We're obviously using quite intense light here with the curing light here, and obviously the accelerator lamp, so it's just a comfort thing. Same kind of principle. The dentist will use a light similar to this to try and hurry up the process, of fillings setting in the teeth as well. So same idea. We're just trying to allow the dam to take its solid form. With the dam, you're kind of constantly trying to strike the balance of making sure that any of the soft tissue or the gum, or that's what's known as the gingival margin, that's all completely covered. But at the same time, you're not wanting to encroach too much onto the teeth either. So you're just looking to just catch that, just a fine line. And obviously you can come up as much as you like on the gum, and it's always good to just build it up a wee bit, which again just protects the gel if it were to slip down the way. So that should be pretty much all good to go. It's quite similar to the front ones there. The bottom one's slightly darker, so maybe just go down a shade. Somewhere along there. I think that's quite close. So we record that, that's 2M1, 2M2. we record that, take a note of it, and then obviously at the end of the treatment we can refer to that and see how we've improved. Now at the stage of just applying the gel onto the surface of the teeth, so we're just making sure that the whole area of the tooth is covered. Okay, so satisfied that the teeth are covered with gel. Next step, just exposing them to the light. So what we're looking to do is just get the light as close to the teeth as possible. It should just fit nicely into the shape of the cheek retractors. Sitting not too badly at that at all. So I think as we've covered before, the light simply acts as an accelerator. You know, these gels are developed with a catalyst in them to react to this particular wavelength of light. So basically it just excites them and it gets a quicker reaction. And that's why we can do this in such a short space of time. You okay? Anywhere from between kind of 12 to 20 minutes, usually 15, although we can tailor it from time to time. So if we say 15 minutes, after 15 minutes we just take this away, clean the teeth, reapply fresh gel, and just repeat that process. It's fairly straightforward, it's perfectly safe, and as long as Louise doesn't try and explain what she got up to at the weekend, then there should be no risk of any gel moving anywhere it shouldn't be. And that's really it. Hope you found that useful. We've actually got loads of videos offering free information on laser teeth whitening, and to access those videos just pop your name and email address in the box and we'll get them to you as quickly as we can.